गुड इवनिंग एवरीवन। जैनु की पाठशाला यूट्यूब चैनल में फिर से आपका स्वागत है। लास्ट लेक्चर में हमने यूनिट 4 वेटनरी पैथोलॉजी उसके जो पेपर सॉल्यूशन है उसके बारे में हमने चर्चा की थी। आज हम वेटनरी पैथोलॉजी का जो यूनिट 5 है जिसका कोर्स टाइटल है एवियन पैथोलॉजी, उसके जो बहुत सारे इंपॉर्टेंट क्वेश्चन और पेपर सॉल्यूशन है लास्ट 5 साल के, उसके बारे में हम चर्चा करने वाले हैं। जो इस चैनल में नए हैं इस चैनल को लाइक करें, शेयर करें और सब्सक्राइब करें। और जिसने भी आगे का जो यूनिट 4 का वीडियो नहीं देखा है वो मेरी यूट्यूब चैनल में जाके वहाँ से आप देख सकते हो। जैसे कि हमने पिछले लेक्चर में भी 2 पार्ट में कवर किया था हमारा लेक्चर को, इस बार भी हम यहीं पे भी 2 पार्ट में कवर करेंगे, पार्ट 1 ऑब्जेक्टिव और पार्ट 2 सब्जेक्टिव। तो सबसे पहले जो ऑब्जेक्टिव इंपॉर्टेंट क्वेश्चन है एवियन पैथोलॉजी की उसके बारे में हम चर्चा करेंगे। तो सबसे पहले जो क्वेश्चन है दैट इज़ द फिल इन द ब्लैंक। वहाँ काफ़ी सारे फिल इन द ब्लैंक एग्जाम में पूछी जाती है, तो उसके हिसाब से मैंने भी यहाँ कवर किया है। तो सबसे पहला क्वेश्चन है कि फाइब्रिनियस पेरिकार्डाइटिस एंड फाइब्रिनियस पेरीहेपेटाइटिस आर द कैरेक्टरिस्टिक लीजन ऑफ विच इन्फेक्शन, दैट इज द ई कोलाई इन्फेक्शन, और इफ यू वांट टू राइट इन डिटेल दैट इज द कोलिसेप्टिसेमिया। Second one question, paralytic form of Marek disease is also known as उसका जो फॉर्म है इसको हम क्लासिकल फॉर्म भी बोलते हैं या क्रॉनिक फॉर्म भी बोलते हैं या रेंज फॉर्म भी बोलते हैं। तो तीनों आंसर आएंगे, रेंज, क्लासिकल और क्रॉनिक। थर्ड क्वेश्चन है विसरल फॉर्म ऑफ द मरेक डिसीज इज ऑल्सो नॉन एज विच फॉर्म। विसरल फॉर्म का जो दूसरा सिनोनिम है दैट इज द एक्यूट फॉर्म। Fourth question है intranuclear inclusion body in the hepatic cell of the poultry are the seen in which disease? That is particularly in the hydropericardium syndrome, or we can also known as the leachy heart disease, or we can also known as the hydropericardium hepatitis syndrome. Anyone you can write hydropericardium syndrome. If you write that is okay. Fifth question is swelling of the infraorbital sinus is seen in which disease? That is actually in particular infectious coryza. Sixth number question, fill in the blank, bodies are the seen in epithelial cytoplasm during the fowl pox. तो जनरली जब भी इंक्लूजन बॉडी की बात करते हैं तो वहाँ पे हमको बोलिंजर बॉडी का नाम हमें याद आना चाहिए। तो आंसर इज द बोलिंजर बॉडी, दैट आर द इंक्लूजन बॉडी पर्टिकुलरली ऑब्जर्व्ड इन फाउल पॉक्स, इन पर्टिकुलर epithelial cell. 7 number, infectious coryza, it is caused by the which organism? That is the Haemophilus paragallinerum. 8 number question, avian influenza type A subtype fill in the blank is responsible for the recent outbreak of the bird flu in Asia and Europe. That is the which subtype? That is the H5N1. And for low pathogenic avian influenza, which subtype? You can answer me into the comment. 9 number question, in avian tuberculosis fill in the blank, and the fill in the blank are the never noticed in tubercle lesion. See, there is a very good question. In avian TB there is the no caseation and the no calcification are observed. Means answer is caseation and calcification are never observed. Like in case of the large animal, caseation and calcification are generally observed. In particular equine TB there is a no caseation and calcification, but there will be a proliferative life of the lesion are observed, in particular tuberculosis in equine. So in avian tuberculosis, 9 number question, caseation and calcification are never noticed. 10 number question, lymphoid aggregates in pancreas of the young chick are seen in which disease? That is the avian encephalomyelitis. 11 number, greenish bronze appearance of the liver is seen in which disease? That is the fowl typhoid. Watery albumin in egg, misshaped egg, it is a characteristic feature of fill in the blank, that is the infectious bronchitis, that is the IB. Chronic respiratory disease is caused by which organism? That is the Mycoplasma gallisepticum. 14 number question, avian influenza is also called as bird plague or avian plague, or we can say the fowl plague. 15 number question, the classical egg drop syndrome 76 is manifested by the sudden fall of the egg production around fill in the blank production. Means जब peak production होता है तब जाके वहाँ के fall of the egg production होता है, means answer is peak. 16 number, linear or the ecmyotic hemorrhage are seen in the thigh, breast, leg and the wing muscle in case of infectious bursal disease. 17 number, why the white bacillary diarrhea is most commonly spread through कैसे स्प्रेड होता है? व्हाइट बेसिलरी डायरिया विच आर द स्प्रेड मोस्ट कॉमनली थ्रू वर्टिकल ट्रांसमिशन. 18 number question, complicated chronic respiratory disease is caused by E. coli plus Mycoplasma gillisepticum, both etiology which are the responsible for the CCRD. Fill in the blank is the most potent hepatotoxic mycotoxin in poultry, that is the aflatoxin. If you specify furthermore, that is the B1 type of the toxin, it is the most potent hepatotoxic mycotoxin in poultry. 20 number question, characteristic lesion noticed in rickets is fill in the blank of the ribs. Means रिकेट्स के अंदर क्या होता है कि कोस्टोकॉन्ड्रल जंक्शन होता है, उसका एनलार्जमेंट होता है. मीन्स आंसर इज एनलार्जमेंट ऑफ द कोस्टोकॉन्ड्रल जंक्शन. एंड द सेकंड थिंग इज रिकेट्स रोजेरी. सेकंड इज द रिकेट्स रोजेरी. मीन्स रिकेट्स रोजेरी भी होता है और कोस्टोकॉन्ड्रल जंक्शन एनलार्जमेंट भी वहां पे मिलता है. Fill in the blank, it is the cause of the blackhead in Turkey. So it is the Heterechis gallinarum. Is the answer is Heterechis gallinarum. Deficiency is responsible for the crazy tick disease. There is a crazy tick disease is caused by the deficiency of the vitamin E, and it is also responsible for the encephalomalacia. 23 number question, the stargazing condition in cheek is caused by the deficiency of vitamin B1. 24 number, Khaljigia deficiency or the fill in the blank deficiency causes the curl toe paralysis in cheek, that is the vitamin B2, that is the riboflavin. 25 number, xerophthalmia and the nutritional root is seen in fill in the blank deficiency, means vitamin A deficiency. Afterward, we have covered the almost all the fill in the blank. Now we'll move toward the objective part, particular you have to the answer the most appropriate. First question is the bacillary white diarrhea in the cheek is caused by the answer is A, Salmonella pullorum. Infectious bursal disease of the chicken, it is the answer is the B, it is a immunosuppressive disease. Deposition of the uric acid and the urates in the organ of the poultry give the prostate appearance. Means here in visceral organ and the articular joint both having the same the prostate appearance, means answer is C. Accumulation of the 5 to 10 ml of the clear watery fluid in the pericardium of the chicken, that is observed generally in answer A, hydropericardium syndrome. Big liver disease in poultry is caused by the which organism, that is the oncovirus. 7 number, the chicken infectious anemia virus belongs to the single stranded DNA virus family, that is the Sarcoviridae. 8 number question, the helicopter disease in poultry is known as, it is known as the infectious stunting syndrome, runting stunting syndrome, and the malabsorption syndrome, means answer is D. Why it is helicopter? Actually it is bird's feather is look like the helicopter. Whatever the wing of the helicopter, same the bird's feather will be look like, that's why it is known as the helicopter disease. Esophagus during the nutritional loop, generally vitamin A deficiency condition in poultry reveals what will happen actually, means answer is A, spherical nodule around the 1 to 2 mm in diameter. 10 number question, in the carrier birds the ova become the discolored, angular, fasciated, and they develop the long stalk in the dish disease, that is observed in particular pullorum disease. Presence of the cheesy matter in the air sac is the indicative of chronic respiratory disease, that is the CRD. 12 number question, the yellowish white nodule, the small bump like nodules are the observed in lung are the characteristic of which disease, that is the aspergillosis. Normal yolk sac contain the change from the yellow-green viscid material to yellow-brown watery material with foul smell when contaminated with, answer is B, that is the colibacillosis, or we can say the E. coli infection, और इसका दूसरा नाम है मुजी चिक disease. 14 number question, chronic granulomatous inflammation may be observed in which disease, that is generally observed in brooder pneumonia, answer is A. In avian influenza, how many subtype of the hemagglutinin are there? 16. What about the NA neuraminidase? You just comment and say answer. I will correct. 16 number question, in CIA virus it is generally spread by C, means both type, it is vertically also transmitted, horizontally, means answer is C. CIA means chicken infectious anemia. Virus of IB means infectious bronchitis, that is the coronavirus. Infectious bronchitis disease cannot replicate, कहाँ नहीं replicate होता है, that is in brain. बाकी respiratory tract, intestine और kidney में वो replicate होता है, just in brain particular virus is not replicating. 18 number question, the which of the following is the microscopic lesion of infectious laryngotracheitis? What will happen? In ILT, syncytia formation is also observed, particularly whatever the cells, the loss of the cell is there, and the presence of the intranuclear inclusion body. Means answer is the D. Central chromatolysis is a pathognomic lesion of the which disease? It is observed in particular avian encephalomyelitis. What is the full form of the MRSA? MRSA, it is the Murex disease tumor associated surface antigen. Answer is A. High mortality is found in the following pathotype of the Newcastle disease. Generally, it is observed in velogenic type of the pathotype. Answer is B. Immunosuppressive disease in poultry, which is infectious bursal disease, chicken infectious anemia, Murex disease. The answer is D, all of above. Argus periscus is a vector of the which disease? That is the answer is D, spirocatosis. 24 number, sudden death syndrome is also called as flip over disease. Answer is B. Which of the following cause clinical disease in newborn chick? That is the particular A, avian encephalomyelitis. Chicken infectious anemia virus destroy the which cell? That is the T cell. In particular IBD, infectious bursal disease, it is targeting the B cell. So in 26 number, answer is B, T cell. Vertical transmission occur in which disease? It is generally observed in fowl typhoid. It is observed in CIA, chicken infectious anemia. It is also observed in avian encephalomyelitis. Means answer is D. Piling up is a disease of the which season? Piling up means इकट्ठा होना, इकट्ठा होना. That is generally occur in winter due to the cold weather. Answer is C. Cooked meat appearance in which disease? Means cooked meat type of the appearance of the carcass of the poultry. It is generally observed in heat stress. That is answer is B. Which one is the zoonotic disease? See, avian tuberculosis, campylobacteriosis of the poultry, and the fowl paratyphoid, all are the generally considered as the zoonotic disease. Means answer is D. Which of the following is the most potent aflatoxin? That is the, I have told earlier also, B1 is the most potent aflatoxin, you remember. 32 number, MD, Murex disease is disease of the chick, broiler, layer, or both B and C. Means generally it is observed in layer. You all know the age of the particular MD when it is start. So you have to difference between the MD and ALC. Many times it's question will ask in exam. 33 number, which type of the hypersensitivity reaction is seen in IBD infection? So generally it is the 3, hypersensitivity reaction 3. Answer is C. Now we have covered the very good interesting question of the objective. Now we will move toward the particular true and false. First question of the true false, that is the brooder pneumonia is caused by the Aspergillus flavus and fumigatus. Yeah, right, means true. Second number, avian encephalomyelitis is also known as epidemic tremor. Yes, true. Yolk sac infection is also called as Muzzy cheeks disease. Yes, true. In flip over disease, there is a chronic cardiac failure. See here, it is a very good question. In a flip over disease, it is not a chronic cardiac failure, but it is a acute cardiac failure. So answer is false. 4 number, false. Cecal coccidiosis is caused by the Eimeria tenella. Yes, right, true. Infectious hydropericardium syndrome is caused by the adenovirus. True. Cell-free Murex disease virus is found in T lymphocytes. See here, two type of the Murex disease virus. One is T cell associated, and that is the associated. Another is the cell-free. Means free virus which are the enter into the feather follicle, whereas the associated virus is always remain into T lymphocyte. So cell-free remain in the feather follicle. So 7 number answer is the false. Viscerotropic velogenic Newcastle disease virus is characterized by the intestinal necrotic ulcer. Yeah, it is a true. Means it is found in the hemorrhagic type of the necrotic ulcer into the intestine and the cecal tonsil. Means answer is true. Motile spin appearance is seen in spirocatosis. True. Greenish bronze appearance of the liver is seen in pullorum disease. False. It is observed in fowl typhoid. Inclusion body hepatitis is caused by the herpes virus. False. It is caused by the actually adenovirus. 12 number, viscerotopic velogenic Newcastle disease is characterized by the tumor in proventriculus. False. वहाँ पे ट्यूमर नहीं मिलता है, वहाँ पेट्रिचियल हेमरेज मिलता है प्रोवेंट्रिकुलस में. So 12 number answer is false. Holte and the Gray strain of the infectious bursal disease virus cause. Holte and Gray strain generally it is of the infectious bronchitis, not for the infectious bursal disease. So 13 number answer is false. In the Gumboro disease, lymphocyte proliferate into the bursa of the fabricus. No, actually here the depletion of the lymphocyte. There is no any proliferation of the lymphocyte. It is observed in bursa. And the 14 number question, particular answer is the false. Lymphocyte proliferation you will get in case of the Murex disease, or you can also get in particular whatever the avian leukosis complex. So 14 number answer is false. 15 number, the most common lymphoproliferative disease of the chicken is avian tuberculosis. No, lymphoproliferative disease is generally MD and the LL. So 15 number question answer is false. Mesogenic strain of the Newcastle disease cause the low mortality, yes, and is following the respiratory and nervous sign, both having the signs, means answer is true. 17 number, lymphoid leukosis is characterized by the enlargement of the liver by infiltration of the erythrocyte. So here answer actually generally it is not a infiltration of the erythrocyte, because of if it is a erythroid leukemia, then it is the erythrocyte infiltration. But here lymphoid leukosis means lymphoid proliferation is the cell, lymphocyte cells proliferation is there or infiltration. So 17 number question answer is false. Infectious bursal disease and immunosuppressive disease, yes, true. In human being, Newcastle disease virus cause the conjunctivitis. True, it is a zoonotic disease and causing the conjunctivitis. Avian pseudotuberculosis is caused by the Mycobacterium tuberculosis. No, false. Mycobacterium tuberculosis is responsible the avian TB, whereas the avian pseudotuberculosis is caused by the Yersinia pseudotuberculosis. So 20 number answer is false. Pasteurella multocida, it is a causal agent of the fowl typhoid. False. It is a causal agent of the fowl cholera. Murex disease virus sedated into the nasal discharge. False. Actually, it is sedated into particular feather follicle. You remember it. 23 number question. The heavy loss in the infectious bronchitis is due to the heavy mortality in chick. Yes, true. It is occurring to the baby chick. The main spread of the EDS 76, that is the egg drop syndrome 76, is vertical. True. In infectious bursal disease, cell-mediated immunity is principally affected. No, false. Actually, humoral mediated immunity is principally affected. In 26 number, Murex disease and the avian leukosis are the non-neoplastic disease. False. Answer is false, because if it is a generally neoplastic disease. 17 number question, in particular, Eimeria acervulina is more pathogenic than Eimeria nicatrix. False. Actually, Eimeria nicatrix is more pathogenic than Eimeria acervulina. Syngamous trachea is known as the lung worm. No, it is a false. It is actually tracheal worm. It is not a lung worm. Means answer is false. Turkish towel appearance of the crop mucosa is seen in moniliasis. Means true. 29 number true. 30 number question, bird are prone to the gout as they are the ureotelic. False. Actually urea excreted नहीं होता है, uric acid excreted होता है. 31 number, birds are the prone to the gout as they have the enzyme uricase. Actually वहाँ पे false. Actually enzyme uricase वहाँ पे birds के अंदर नहीं होता है, तो means answer is false. 32 number, ascites is caused by the chronic congestive cardiac failure. Yeah, it is a chronic heart failure that is the responsible for the ascites, means answer is true. Stargazing posture is seen in riboflavin deficiency. So riboflavin deficiency, that is the false, because of it is caused by the vitamin B1 deficiency. 34 number, the deficiency of the vitamin A in hands may show the serothalmia. Yes, true. 35 number, deficiency of the vitamin E cause the encephalitis in chick. No, it is causing actually encephalomalacia, not causing encephalitis. So 35 number answer is false. Now after the true false, we will move toward the match the column. From the column A to column B, you have to the match particular question. First, it is the big liver disease that is known as lymphoid leukosis or the avian leukosis complex. Range paralysis, that is the particular the G, answer Marek's disease. Blue wing disease, that is the particular chicken infectious anemia. Gumboro disease, that is the infectious bursal disease. Avian pneumoencephalitis, that is the Rannicate disease. You remember the Rannicate disease synonym. Epidemic tremor, that is the avian encephalomyelitis. Bird flu, that is the particular avian influenza. Angara disease, that is the hydropericardium hepatitis syndrome. Helicopter disease, that is the infectious stunting syndrome. Turkey coryza, that is the rhinotracheitis. Second number, that is the in case of the etiology in disease and etiology, you have to the match. Infectious bronchitis, that is the coronavirus. Infectious bursal disease, that is the Birna virus. Infectious laryngotracheitis, that is the Gilead herpes virus 1. Marek's disease, that is the Gilead herpes virus 2. RD, particular paramyxovirus. Rannicate disease, that is the paramyxovirus. Avian encephalomyelitis, that is the caused by the picornavirus. Inclusion body hepatitis, that is caused by the adenovirus. Lymphoid leukosis, that is the caused by the retrovirus, and retrovirus particular oncovirus. Avian influenza, that is the particular caused by the orthomyxovirus, and the orthomyxovirus in particularly you can say the influenza type 1. Avian influenza type 1. CIA, that is the chicken infectious anemia caused by the sarcovirus. Afterward, some of the again the certain etiology like the pneumoencephalitis, that is the avula virus. Avula virus, that is the Rannicate disease. Fowl pox, that is the AV pox virus. Turkey blue comb disease, that is caused by the coronavirus. It is very good important question. Avian nephritis or the runting syndrome. Avian nephritis. You remember that particular avian nephritis, that is the picornavirus, enterovirus. Avian nephritis, that is the picornavirus, enterovirus. Rouse sarcoma virus, that is caused by the alpha retrovirus. Avian reticuloendotheliosis, that is caused by the gamma retrovirus. Cetacean beak and the feather disease, that is caused by the sarcovirus. Turkey rhinotracheitis, that is caused by the metapneumovirus. Fowl plague, that is caused by the avian influenza virus. Marble spleen disease, that is particularly caused by the adenovirus. Afterward, some of the bacterial disease and the etiology is there. You have to the match. Fowl cholera, that is the caused by the Pasteurella multocida. Fowl typhoid, Salmonella gallinarum. Avian spirochetosis, that is by Borrelia enserina. Limberneck, that is Clostridium botulinum. Infectious coryza, that is the Haemophilus paragalinarum. Ulcerative enteritis, Clostridium cholinum. Hazares disease by the E. coli. Pullorum disease, that is caused by the Salmonella pullorum. Bumblefoot, that is caused by the Staphylococcus aureus, and Muzzy chicks disease caused by the E. coli. And in case of the 7 number, Hazares disease, it is also caused by the E. coli, but here in the maze they given the cholegranuloma, means cholegranuloma or Hazares disease, that is the synonym, and it is also caused by the E. coli. Afterward, some of the important aspect of the particular virus and the particular disease, like the nephrotoxic infectious bronchitis, means which strain, that is the T. Gray and Holte strain. T. Gray and Holte strain. Myeloid leukosis, that is the J virus. Parosis, that is particularly caused by the deficiency of the manganese. Fowl pox, in which Bollinger bodies is seen. Lymphoid aggregates in pancreas, that is observed in avian encephalomyelitis. Ascites, that is observed in particular right ventricular hypertrophy. IBD, that is generally the type 3 hypersensitivity reaction. Avian chlamydiosis, generally it is elementary body is seen in avian chlamydiosis. Soft celled egg, generally observed due to the calcium deficiency. CIA, chicken infectious anemia, that is caused by the sarcovirus. Again, some of the important aspect of the disease and some of the important lesion, like the Murek's disease, that is the causing the pleomorphic lymphoid cell infiltration. You remember, whenever the lymphoid leukosis, there is the uniform lymphoid cell infiltration. Avian spirochetosis, there is the enlarged in the motor spleen. Newcastle disease, particularly Lasota vaccine is available for the Newcastle disease. Rastic rosary, generally due to the calcium, phosphorus and the vitamin D3 deficiency. Aspergillosis, generally the lung nodules in the brooding cheek is observed. Infectious bronchitis, you will get in particular coronavirus. Bleeding disorder, generally observed in vitamin K deficiency. Ascites, generally observed in chronic congestive heart failure. IBD, that is observed generally in muscular hemorrhage. Means muscular hemorrhage is observed in IBD, infectious bursal disease. Afterwards, some of the important pathognomic lesion of the important disease, like inclusion body hepatitis. You will get the intranuclear inclusion bodies in hepatocyte, in particular hepatocyte. Second, IB, infectious bronchitis. You will get watery whites, or we can say the blind layer, watery white of the albumin or the blind layer. IBD, infectious bursal disease, in which the diffuse hemorrhage at the junction of the gizzard and proventriculus. You remember, diffuse at the junction only, where the petechial hemorrhage is observed in the proventriculus, that is observed in Newcastle disease. Rannicate disease, fourth number question, that is the B, hemorrhage at the tip of the proventriculus gland. IB, infectious bronchitis, in which the gasping disease is known as the gasping. CIA, chicken infectious anemia, it is causing the gangrenous dermatitis and aplastic pneumonia, aplastic anemia. ILT, it is responsible for the pump handle respiration. MD, it is responsible for the thickening of the sciatic nerve and the brachial plexus. Murek's disease. In pox, fowl pox, it is causing the granular eruption in the comb and the wattle. And EDS 76, it is responsible for the thin celled, soft celled and the cell leg age. EDS 76. Afterward, the sum of the vitamin, and it is the particular which vitamin is responsible for the which, like the anti-infective vitamin, that is the vitamin A. Anti-sterility vitamin, that is the vitamin E. Anti-rastic vitamin, that is the vitamin D. Anti-pellagra vitamin, that is the niacin, that is known as vitamin B3. Anti-beriberi vitamin, that is the vitamin B1. Anti-dermatitis factor, that is the vitamin B5. Pantothenic acid. Anti-scurvy vitamin, that is vitamin C. And whatever the vitamin H, it is known as biotin or vitamin B7. Whatever the vitamin A, that is the folic acid, and vitamin G, that is the riboflavin. Afterward, the sum of the important disease condition and the deficiency of the which disease condition are causing the particular condition. Star grazing, it is caused by the vitamin B1 or the thiamine deficiency. Coltopelalysis is due to the riboflavin or the vitamin B2 deficiency. Crazy chick disease, that is caused by the vitamin E deficiency. Stuttgart disease, that is due to the niacin deficiency. Goose tipping gait, it is occurred due to the pantothenic or the vitamin B5 deficiency. Pernicious anemia, it is caused by the vitamin B12 deficiency. Battery sickness are occurred due to the vitamin C deficiency. Rastic rosary occurred due to the vitamin D, calcium or the phosphorus deficiency. Here answer is vitamin D. Keratomalacia is occurred due to the vitamin A deficiency. Condor dystrophy, that is occurred due to the vitamin biotin or the vitamin B7 deficiency, or also is observed in manganese deficiency. After, some of the important parasitic disease, in which the dumpling itch, it is occurred due to the Cnemidoctus galine. Answer is B. Gapeworm or the forkworm, that is the Syngema trachea. Answer is H. Largest nematode of birds, you remember this, that is the Escadia gali. Smallest nematode, that is the Capillaria species. Largest tapeworm of the poultry, that is the Relitania tetragona. Smallest tapeworm of the poultry, that is the Davinia proglotina. Oviduct fluke of the poultry, that is the Prosthognemus species. Sickle worm of the poultry, that is the Heterechis gallinarum. Avian malaria, it is the particular caused by the Plasmodium juxa tenclure. उसके बाद है इन्फेक्शियस एंटेरोहेपेटाइटिस और ब्लैक हेड डिजीज. इट इज जनरली बाय द हिस्टोमोनास मेलिया गिडिस. This all about the objective. Now the some of the definition part. We'll see the define which of the following you have to the define. First one, that is the favors. Second, that is antigenic drift. Third, smoothing. Fourth, cannibalism. Fifth, gout. Sixth, epidemic tremor. Seven, fatty liver injury syndrome (FLKS). Eight, Brooder's pneumonia. Nine, xerophthalmia. 10, polyneuritis. 11, helicopter disease. 12, parosis. 13, egg bound condition. 14, torticollis. 15, shuttle program. 16, Leach's heart disease. 17, paralysis. 18, crazy chick disease. 19, watery whites. 20, internal layer or the blind layer. 21, ornithosis. And 22, bumblefoot. Afterward the define. Now we will move toward the part 2, which are the subjective, which are the most important and important question I have covered. First one, for the long question, you have to the write the etiology, transmission, clinical sign, pathogenesis, lesion, gross and the microscopic lesion, or the whatever the important pathognomic lesion. If you write, that is the more than sufficient. Then the diagnosis of the following disease. First disease, that is the Newcastle disease. It is also known as Raniket disease. Second is the avian influenza. Third is IBD, infectious Brussels disease. Fourth one, the Merrick's disease. Fifth one, aspergillosis or the Brooder pneumonia. Sixth one, that is the aflatoxicosis. Seventh, it is the some of the pathological condition associated with the salmonella and the described in detail about the fowl typhoid. Same like the pathological condition associated with the E. coli, answer in the detail, or the enlist the particular condition and answer regarding the cholesepticemia in detail. After the long question, some of the important short note. That is the first, that is the chicken infectious anemia. Second one, it is the fowl pox. Third one, that is the sickle coccidiosis. Fourth one, the gout in poultry. Fifth one, that is the fowl cholera. And sixth one, that is the ascites in poultry. Along with, you have to the make the list of the end list of particular poultry disease. First one, that is the immunosuppressive viral disease of the poultry. Second one is the vertically transmitted disease of the bacterial and the virus. And last one, you have to the enlist the various poultry diseases like the bacterial causing disease, viral causing disease, fungal causing disease, parasitic disease, metabolic disease, or the deficiency disorder. At least you have to know that at least 5 of the particular each of the particular section of the each disease. Afterward, some of the important differentiate, which are the important, you differentiate this 7, that is more than sufficient for your exam point of view. Marek's disease versus avian leukosis complex. Second one, infectious bronchitis or infectious laryngiotracheitis. Third one, pullorum disease versus fowl typhoid. Fourth one, high pathogenic avian influenza versus low pathogenic avian influenza. Fifth one, wet pox versus dry pox. Sixth one, fowl cholera versus infectious coryza. And 7 number, aspergillosis versus aflatoxicosis. So here I think I have covered the many things, and for exam point of view, almost from this part 80 to 85% of the question from the objective or the subjective part will definitely for your internal or any of the external or the annual board exam or anywhere in the country. If you are studying in any college of the any country, these are the 80% of that particular portion I have covered for the important question in paper 2 and also in particularly in internal exam. So thank you very much. Thank you once again. I will upload the regarding the unit 6 also. So keep watching and keep updated and stay tuned and good luck. Thank you.